Hi, my name is Stacy. I'm 20 years old, and 1 year ago today, I was diagnosed with ovarian cancer. The symptoms started around mid-May, and I didn't think anything was wrong at the time because I was roller skating at Sonic. It's a fast food restaurant where they roller skate the food out to you, and I was doing that 4 times a week. And this first symptom that started was pain in my back and abdomen. And I didn't think anything was wrong because I thought I was just skating too much. So, it was mid-May, and I just continued working until around May 17th. I fell to the floor, cringing in pain in my abdomen, and that's when I knew something was wrong. So I was with my sister, and even though I thought maybe it could just be cramps, I let my mom know anyway. And within 15 minutes, she made an appointment for me to see the doctor the next day. I've never had a serious problem in my life, so my doctor was still a pediatrician. So I went to go see Dr. Chan, and he said that I was skating too much, so I just needed to take a break from work for a week, and I did. So I stayed home, I relaxed, and things seemed to have gotten better. I wasn't in pain anymore, so I went back to Dr. Chan. He said everything was fine, I can get back to work, so I did. And I was back at work for about a week when the symptoms started coming up again, but this time they got worse. The pain got a lot stronger. My stomach started to get really bloated to the point where it looked like I was starting to look pregnant, and there's no way that's possible because I'm a virgin. So I went to him again. This is the second time I went to him, and he thought maybe something was wrong this time. He thought maybe it was a hernia, so I went to him, and he said I'll take another week off of work, which I did. And I was feeling okay, but after that break, I didn't go back to work. I saw Dr. Chan for the third time because he wanted to see if I got better from resting or if it had gotten worse, and it had gotten so much worse. I was so bloated, and my stomach was hard to the touch. So we really didn't know what was wrong. He's a pediatrician, he doesn't deal with things that serious. So he wanted me to go get an ultrasound. And that was the third time I'd visited him, and that was May 28th. And I was at DRA imaging 4 days later, June 2nd, to get my first ultrasound. The ultrasound, the woman doing the ultrasound said that she would send the reports to the doctor, and I would see her after the doctor reviewed them, and that was 2 days later. So June 4th is when I saw the first doctor, and this was a gynecologist. I've never been to one before that. And she examined me, she examined the report, and she couldn't see my ovaries. She said my uterus was the size of somebody who was 5 months pregnant. And she said maybe it was this thing called a molar pregnancy, which is basically like a pregnancy gone wrong. And like I said, I'm a virgin, so there's no way that was possible. So I was told, oh, don't worry about it, see how we feel in 3 weeks, and then come back to me. And that wasn't possible because I was in so much pain, I could barely walk. So luckily, the receptionist at the desk noticed that, I wasn't feeling well. It was either the receptionist or the nurse, and she knew something was up, and I wasn't feeling good. So she was like, "Here, let me get you an appointment with another ultrasound, and see what happens from there." So again, that was 2 days later, and June 6th, I was in the same gynecologist's office to get a second ultrasound, and this time the tech found something, and he knew something was wrong. He couldn't see my ovaries. All he saw was this big mass covering them. So he called in Dr. Turk. And Dr. Turk is probably the reason why I'm still here, because he realized it was a tumor. And Dr. Turk, he's a wonderful doctor, and I'm so grateful for him. But he's just an OBGYN, so he deals with pregnant women, not 19-year-olds with a tumor. But he did realize what kind of tumor it could possibly be, so he sent me to go get some blood work, and he also personally called Dr. Credenzer to set up an appointment with me, the nearest date possible, which was 2 days later, June 8th, on a Friday. Hearing the word tumor, it's life-altering, because immediately when I hear tumor, I think of cancer. Even if tumors can be benign, I think of cancer. So I heard that, and I was really just scared. But I was lucky to get an appointment as soon as I did. So I went to see Dr. Credenzer. He's a gynecologic oncologist. And although I didn't have the best time with him, he's really good at what he does. He doesn't have the best bedside manner, and throughout my whole treatment, I haven't had a good experience with doctors. Not many of the doctors in this area know how to treat, treat some 19-year-old, and I don't mean like medically, but just like emotionally. They don't know how to treat one. So there I am, 19 years old, and I'm hearing the word tumor and ovarian cancer, and just 2 weeks prior to that, I thought I just had a hernia, or quite possibly an ovarian cyst. So then, when you're getting sent to go to the Dyson Center, which is a cancer center, to have an oncologist look at you, it's scary. And he examined my reports, my ultrasound reports, and then he examined me. And after that, he brought my mom and me into the conference room. When you're brought into a conference room at an oncology office, something's wrong. They're going to tell you bad news, even when you don't. So I sat in the office, and he told me that it's most likely this tumor called a germ cell tumor. And I've never heard what a germ cell tumor is. And he explained that it's basically the type of tumor that Lance Armstrong had. He had testicular cancer. It's just an ovarian form of that. And so I asked him how many times he'd seen this before in his practice. He said 3 times. Germ cell tumors are extremely rare. The chance of them occurring is like 1 in 2 million, and they only account for 3% of ovarian cancer. He told me that there's a chance that it couldn't be cancerous, and that's what we had to pray for, but he said that if it were cancerous, I'd need to start chemo. And he assured me from the start that the chemotherapy regime, has a 92% success rate. So even if you're in stage 4, which I was, even if you're in stage 4, it can cure you. Or it can cure your tumor. I only thought that ovarian cancer was ovarian cancer, a tumor is a tumor, but there's a whole different, so many different forms of it. And so he told me that if it was cancerous, I would need to start chemotherapy after surgery and everything. And my first words to him, I wasn't worried about having the scar, a scar starting from my belly button down, and going 8 inches down. I wasn't worried about that. I wasn't worried, whether I'd survive or not because of the success rate. But I was worried about losing my hair. And if any of you know me, you know that in 19 years, I'd never had a haircut. I had hair down past my butt. And I loved my hair. And that's the first question I asked him, am I gonna lose my hair? And as soon as I asked that, it brought tears to my eyes because I loved my hair. And he told me it's just hair, it grows back. And that's heartbreaking to hear when, you identify yourself with long hair. You don't ever think about being bald. You don't think about having short hair. No, I was the girl with long hair. And I lost it. I started crying after he told me that. But we basically just made the plans for surgery. He wanted me to go get blood work. He wanted me to go get blood work done after our meeting. So our meeting was over within a couple minutes of him telling me that, you probably have cancer and you're going to lose your hair and you're going to need surgery and you're going to do this and that. And he told me, and this is very insensitive the way he said it, but he told me that he's gonna drag me through the mud this summer. He's gonna bring me through the ringer, and he said it's gonna be hell. And I wasn't so sure I believed him, but he was right. And although I did not have a good experience with him, he was right. But it's still scary to hear. And he said that I needed surgery right away because my tumor was very big. It was the size of a volleyball and it weighed 12 pounds. And my stomach, it was huge, it was bloated, it was hard to the touch. I couldn't even walk. I was in so much pain for about 3 or 4 weeks. I was in pain until, I really finally got an answer as to what was wrong. And, that kind of thing is scary. So, he told me I would need surgery right away. I saw Dr. Credenzer on Friday, June 8th. And, he normally practices up in Albany. He's only in Poughkeepsie once a week. And that's Fridays, so he said, you can go up to Albany to be on pain management for the weekend until I do your surgery on Monday, or you can go on Monday and have your surgery then. And I've never had surgery in my life before this, and I wasn't ready to do that, so I told him I want to go home, have a normal weekend, get prepared for my trip, for, my life to basically change completely over the course of 3 days. And then I was on my way to Albany. He gave me painkillers for the weekend before I went. It really didn't work because I could barely even get up to go to the bathroom. It hurt that bad. My stomach, I was holding it like I was pregnant. I had to hold it like that. I had to hold my back. It was ridiculous. And I was like that all weekend. I spent time with my family, saw my grandma, hung out with Arturo. He stayed there with me like all weekend too. And then Monday came. Monday, June 11th. That's a year ago exactly today. Monday, June 11th, I was told that I had cancer. I came, and I was just in so much pain that I wasn't allowed to eat or drink Monday because you're not supposed to for surgery, so I was in a lot of pain. All I did was take some painkillers for the ride, which then I took some painkillers for the ride, and then got into the truck, which my family padded up with cushions and pillows and everything for me. Got into the truck, and I was on my way for the 2-hour ride to Albany. And I was in and out of consciousness for that ride. I was tired, I didn't feel good, I was in pain. Any bump in the road hurt. So I just tried to sleep it off. I had Arturo sitting there right next to me, making sure I was okay. I had my sister in the back. Mom and Scott were, just making sure they were driving slow and taking care of me. And I arrived at the hospital. They gave me they put me in a wheelchair to bring me up to get prepped for surgery. Had to, get a hospital gown on, have an IV put in, and then they started the anesthesia. The anesthesia really freaked me out. I wasn't really worried about the surgery or anything. It was the anesthesia. I had never really been forcefully put to sleep before, where some other person was in control of my body. It was like such a scary thing to me. But the IV was in. My mom was with me the whole time, so that made me feel better. I told her I was gonna be okay. As soon as it started working and I was getting drowsy, they told me, oh, we have to bring her to get ready for surgery. And after my surgery, I wasn't really too sure how the time frame played out. I know that I was in the hospital for 4 days, and I know that I woke up after my surgery, somehow called my mom from my cell phone. I don't even know how I could dial her. I couldn't even open my eyes, and I called my mom. I'm like, Mom, I'm done. And that was that. I told her I was done. They brought me to my hospital room where I would stay for 4 days, and they told me, when I was conscious, Dr. Credenzer and his team came in to tell me that the pathology on the tumor came back, and I had cancer. They told me that it was this, germ cell tumor, but my tumor was literally a category within a category within a category. It was ovarian cancer, it was a germ cell tumor, and then also it was an embryonal yolk sac tumor. And it's just all these names, and it's a tumor, you're sick, you have cancer. And they told me the chemotherapy that I would need, which is called BET, it's bleomycin, etoposide, and cisplatin. It's a really harsh chemo concoction because it just messes with your lungs, it messes with your hair, obviously, it messes with your body, it changes your skin tone, it makes you nauseous. I got so sick. That chemo is very strong. With normal cases, they will only do 3 rounds of chemotherapy, and the fact that my doctor told me I was going to have 4, it actually surprised a lot of other doctors. They're like, oh wow, they don't normally do that. That must have been serious. And it was serious because my tumor was 12 pounds. It was the size of a volleyball. It disintegrated upon removal. It spread all over my stomach, my abdomen. The cancer cells spread all over. It affected my right ovary, my right fallopian tube, my omentum, lymph nodes, and a section of my small intestine. So they removed all of that. The official name for the surgery I had is a unilateral salpingo-oophorectomy. All these medical terms just to tell you you're sick and we need to fix you. So, I had to prove that I was getting stronger day by day in the hospital. I was there for 4 days, and by the last day, I was doing well. I was walking, I was going to the bathroom on my own, and then the nurses came in. Nurse Lisa came in, and I remember her telling me that, oh, we're gonna do a second surgery on you. I'm like, what? Second surgery? I'm like, it's only gonna be like 30 minutes long, you won't be asleep for it, they'll just, local anesthetic, or I guess they just numb you, and, they're like, yeah, you're gonna get a power port, so it helps save your veins during chemo. I had no clue. I had no clue what a power port was, and the way she explained it was so weird. It's a quarter-sized, device that they place under your skin. You can kind of see it poking out right here. They place it under your skin, and if you could see, it's got this line that's going over my collarbone, and then it's connected into a blood vessel. This is a picture of what it looks like, basically. I am not annoying! So, when she showed me like what it would look like and stuff, I'm like, I didn't want that. I didn't want some tube sticking out of me. But she said, it's not going to be sticking out of you. What they basically do is put a needle into it, and when they want to access it, and that's how you're administered your chemotherapy. You can get blood withdrawn. And for my full week of chemo, they would keep it accessed, and they would just put like a patch over it. So yeah, it still freaked me out, and it sounds weirder than it actually was. This is what it looked like. I'm just looking for the picture, but this is what it looked like when it was accessed. That's what it looks like when it's accessed, and that was my blood, you know. They were drawing my blood for my tumor markers, but that's what it looks like when it's accessed, and, you know, for the week that it's accessed, it is weird, because I do have tubes hanging out of me, but, other than that, you can't notice it. When I was sick, I was a lot skinnier, and it poked out so bad. But, anyway, so she said, yeah, you're gonna be, transported there in about 15 minutes, you're gonna have the surgery, then you can get discharged. I thought it was ridiculous. I thought, you're gonna do surgery on me 45 minutes before I'm gonna get discharged. And, you know, I was awake for the surgery. I was freezing because they had me in the sterile room. I was awake, and, you know, there was about 5 or 6 people in the room with me working on it and whatever. And, you know, they were just talking to me, keeping me company and stuff, and it really wasn't that bad of an experience. And now that I think about it, I'm so glad that they gave me my power port, because they really would have ruined my veins if they hadn't. So, I'm really glad. So my surgery was done. They were getting the discharge papers ready while I was having my power port placed, and then I was on my way home. The instructions from the doctor was just, every time you see a rest stop, get up to walk so you don't get blood clots. I got home, and I just wanted to go to bed, so I went to sleep that day, and that was that. The next day, I was very sore. I mean, obviously I had pain medicine. I had huge abdominal surgery. They removed a lot, and I have a scar going from here all the way to here. And I had staples, and staples freaked me out because, you know, I thought every time I coughed or any time I threw up that I was going to, like, rip my stomach open. But there's no way that happened, or that would happen. But I was still worried. The day after I got home from the hospital, I was just sitting watching TV with my mom. It was like 9 or 10 at night, and I threw up a lot. I got really sick, and it was just this dark green bile is what they call it. And so we had to call the hospital. We were like, oh my gosh, is something wrong? They're like, no, it's just all the medication that you were giving while you were in the hospital. Everything's normal. Don't worry about it. If you get any sicker, you know, call us back and let us know what's wrong. But everything's fine after that. You know, I was pumped full of medicine. My body was gonna react to it somehow. So the next 2 weeks, I just worked on getting better. I worked on recovery. I worked on walking around the house or walking around the square in my complex. And things were starting to get better. I was walking better. I was able to go to the bathroom without having to clutch a pillow to my stomach. I was obviously so relieved because my back pain was finally going away. When you have a 12-pound tumor pressing on your organs and your spine and everything, it's just tremendous back pain. And to this day, I still get back pain, but I don't have to worry that it's a tumor anymore, so that's good. But like I was saying, 2 weeks into recovery from surgery, I woke up in the middle of the night. It was 1 a.m. on June 25th, and I woke up and I had this pain about right here. It was an absolute terrible pain. It felt as though somebody was taking a knife and just stabbing it and twisting it. And I took pain medicine. I took a laxative. I took a gas pill just to see if anything would work, because my mom wanted to take me to the ER, and for 4 hours I was being stubborn, and I said, no, I'm fine, because I sat there crying in pain. So, it was about 4:35 o'clock in the morning, and I'm like, okay, we have to go to the hospital. And I went to the hospital. They started me on morphine right away, and the morphine wasn't strong enough, so they had to give me Dilaudid. And only then did I start to feel a little bit of relief. And I laid there, and they wanted to give me a CAT scan, so they needed me to drink this liquid so that they could see the insides better. So, you know, did that, got my CAT scan. And then the doctor came in, the ER doctor, no clue who he was, came in and told me that my tumor grew back. It took 2 weeks and my tumor was growing back. So, I had to get admitted to the hospital, but no doctor wanted to admit me because my doctor was a doctor at St. Peter's in Albany. He wasn't really that much of a doctor at Vassar Center. He only worked at Dyson 1 day a week. So they had a terrible time trying to admit me. It took at least an hour or two until somebody from Dr. Turk's practice took the responsibility and admitted me. And then they got me into the hospital room, South Circle 5. And then after that, the doctor on call, he came in, visited me, and told me that I would need this thing called an NG tube to help shrink the tumor so they don't have to do surgery so soon after what just happened to me. So the NG tube, it was so uncomfortable. It caused such a sore throat. It was this tube about probably a little bit thinner than my pinky, and it went up my nose, down through my throat, and I don't know where it ended up. But it was to help shrink the tumor. And I had that in me for 3 days. And because I had tumor growth, I wasn't allowed to eat or anything. And I just wanted to eat. I wanted to feel better. You know, I was on pain management again, and I was in the hospital for 3 days. They did an x-ray of my chest and abdomen, I guess, and decided that it was time to start chemotherapy. And this was, I think, at least 2 weeks too early because I'd just gotten out of surgery 2 weeks prior. And they wanted to start chemotherapy right away. So I met my new doctor, Dr. Rachmala. She was the one that I would be seeing for my chemo treatments and everything. And that's it. I started chemotherapy. Before I started chemotherapy, Dr. Turk called in a special favor from his hairdresser, who works for Locks of Love sometimes, and she cut my hair so that I could donate it, and I ended up having 5 ponytails, each measuring 25 inches long, that I can donate to Locks of Love, and I'm just waiting for an event to show up in my area so that I can do it. And so I'm going to donate to them. But getting my hair cut was such an experience, because I've never had a haircut, and my first one was in the hospital. So, after the haircut, the doctors decided to remove my NG tube. They took it out, and then a few minutes later I started chemo. And chemo didn't really affect me right away. It takes a couple days to work, so you know, I was just sitting in the hospital bed bored out of my mind because all they're doing is pumping me full of toxic chemicals. And I don't know. I had to finish. I'm happy to say that my first chemo was in the hospital just in case anything went wrong. I was already there, but I started my first cycle of chemo, and I started it on June 28th, finished it July 3rd, and then I was on my way home after I finished my last injection. And then, you know, I was feeling fine. My next chemo wouldn't be until the week after, and it was only 1 day a week for the next 2 weeks. And, you know, I didn't start feeling nauseous until like a couple days after I finished my last chemo. And then I started throwing up, and gave me nausea pills, you know, anything to try and keep me comfortable. And, you know, that started my treatments. That was how my treatment started. And then I would make my way to the Dyson Center every week, go get my chemo. Some days I was so sick that, you know, I just wanted to stay in bed. And then some days I felt fine. And it's weird because the days that I usually felt fine, my white blood cell counts were really, really low. And those were usually the days I really wanted to do something after chemo. But I was always advised against it. So, I guess now I just talk about how chemo affected me. It made me nauseous. Very, very nauseous. I normally weigh about 120, 118, 120, and chemo got me dropped down all the way to 100 pounds, and I looked like a skeleton, and I had no appetite. I was so sick. I didn't want to eat anything, I didn't want to drink anything, just because I thought, oh, I'm going to get sick if I do this, I'm going to get sick if I do that. So the doctor actually had to prescribe this pill for me. It's called Marinol. It's kind of like synthetic marijuana. I don't like the pill, I don't like how it makes me feel, but it made me eat, and it took away the nausea, and it worked. And I was able to gain 7 pounds, and then I'd start my next treatment, and I'd lose those pounds, and go back to 100, and it was a roller coaster for each treatment. And now I'm finally at a healthy weight. I'm like 120 pounds, and I'm healthy, and just working on getting better. Chemo also gave me a really bad ringing in my ear, and even though I've been done with chemo since September, I still have some of the side effects. I still have ringing in my ear. I have brown stripes. You can't really see them, but I have brown stripes from the bleomycin. Bleomycin also affected my lungs. Cisplatin was what made the ringing in my ear progressively worse. I had tingling in my feet and hands. My feet were numb. I lost my hair. I had a metallic taste in my mouth all the time. I had my brown tiger stripes going all the way up and down my torso. I was in a lot of pain. I had surgery, abdominal pain, chemo, it all made it worse. It would make my counts drop really low, to the point where I would need blood transfusions, and I had about 5 of those, 5 blood transfusions. And then I also needed to get this shot called Neupogen, which is designed to make your white blood cells produce really fast, so that you could be ready for your next round of chemo, just for them to get knocked down again. And the Neupogen, although it worked, it's painful. It makes you feel like your bones are being hammered. It makes you feel just makes you feel really sick for the 2 days after you get it. And with each chemo treatment, I got sicker and sicker until my last one. My last one landed me in the hospital for the 3rd time. I threw up 7 times in one night, and I had to go to the hospital because no amount of nausea pills were working. And the ER doctor had me started on nausea medicine instantly, pain medicine, and they took my blood just to see what was wrong. My potassium and my magnesium were dangerously low, so low that if I hadn't had gone to the hospital, something would have been really serious. And also my white blood cells were very, very low, so they had to keep me in complete isolation. They wouldn't even let me have ice because ice could have bacteria in it. That's how serious it was. So I was admitted right away. They didn't have to ask any doctor this time. The ER doctor admitted me right away. And they just kept me there for a week, just like my first day. I was there for a week. I was in the hospital. I started chemo in the same room, ended chemo in the same room, same nurses. And it just made me really sick. and I was afraid to even start my last thing of chemo because my counts were so low that they ended up giving me 4 shots of Neupogen, and the normal is 2, and I got 4. So they gave me that, and finally my counts were high enough that on September 11th I finished my last session of chemotherapy, which was just the bleomycin, and I was done. But I stayed in the hospital for 2 days afterwards just because my magnesium and potassium were so low. They had to keep giving me these riders that bring the levels up. There's not much else to say about that except I got really sick. And chemotherapy made me sick, and I thought once I finished chemo, I'd be done. I'd be like, okay, I'm recovering. I only just finally started to feel better around March. And also, I forgot to mention this, but chemotherapy ruins every part of your body. It basically kills every cell just to regenerate them. And they wanted to save my remaining ovary, my left ovary. So they gave me this shot called Lupron, and it basically put my ovary to sleep for the months that I had the chemo. And I was afraid it wasn't going to wake up, but it actually started just waking up in March. Started waking up in March, and things are going back to normal. Before my ovary woke up, though, I was having really bad hot flashes and menopausal symptoms, and that's normal. You know, you're not producing estrogen or anything, so you're not gonna. So they basically put me in temporary menopause, and I was getting really, really bad hot flashes. They were so intense that I couldn't sleep. I couldn't even relax without having to go outside in the cold winter air. So my doctor, he prescribed me Paxil. It's an antidepressant, but it also helps relieve symptoms. It also helps relieve hot flashes. And I'm not sure how or anything, but I started taking it, and within 10 days, they were gone. They were completely gone. And I thought it was such a blessing to finally feel better. But Paxil is not a good medicine. I stopped taking Paxil 11 days ago, and I had only taken it for 3 months. 3 or 4 months. I think I started it in February, and I was only on 20 milligrams. And I decided to stop taking it. I thought June 1st, new month, I want to get better. I want to stop being a sick person. I don't want to take medication because I'm not sick. So I'm actually not taking any medication currently, except for pain medicine and nausea medicine as needed, sleeping pills as needed, anxiety pills as needed, but even that's very, very minimal. So when I stopped taking the Paxil, I didn't think I was going to go through a withdrawal because, you know, it wasn't for depression, it was for hot flashes. And I wish I'd never started taking it. I would have dealt with the hot flashes because the Paxil is so bad for you. It for the first 10 days, I had a pounding headache, and I was so sensitive to sound, and I couldn't stand up without feeling dizzy or lightheaded, and I felt nauseous, and now my stomach's hurting, and I don't know if that has to do with what today is or just in general, because today is, 1 year since my diagnosis. It's a very difficult day for me. so I don't know what the stomach pain has to do with today, but I was just so lightheaded, and I'm still going through the withdrawal, and I'm never going to take it again, no matter how much it helped me. So just if any of you ever are given the choice to take it, just be very careful, because it's really dangerous. The withdrawal symptoms just leaves you crying and dizzy, and you just feel so sick. And here I was thinking I was recovering and doing so well, and then something like that happens, and it's kind of depressing to think that I was working so hard at getting better, and there it was gone because I stopped taking the medicine. But this medicine, it was causing really bad nausea. It was, I didn't think I needed it, so I just stopped it. And that was the wrong thing of me to do. I should have gradually done it, but I'm getting over the withdrawal now. I'm feeling better. It's day 11 without it, and I'm feeling a lot better than, say, day 3. But it's still really hard to take that medicine and just stop it. So I definitely, I've learned to kind of be my own advocate when it comes to taking medicine. Be my own advocate when it comes to like what I put into my body. I mean, sometimes when people get diagnosed with cancer, they do this whole holistic approach where they just do natural remedies. And I believe in chemotherapy because it does work. But as for recovering, I think I'm just going to work on just being as natural as I can about it. If I need pain medicine, I'll obviously take it. I don't want to be in pain. Like, right now my back hurts because of the way I've been sitting, and you know, I'll take pain medicine, but I'm not going to go down the path that I was going with taking 7 medications a day. I was literally on magnesium. I was taking a laxative. I was taking Colace. I was taking this thing called gabapentin, which helps your nerves, and I was on the Paxil. And I went from taking 7 medications a day to taking almost none. So now I'm just working on feeling better and getting stronger. And last summer I spent the majority of it in the hospital. I spent the majority of it at Vassar, and this summer I just plan on enjoying it. I plan on, you know, just living my life and doing the best I can to enjoy it. If I have any advice, it's research your doctors, because I had been dealt a lot of bad doctors, and you know, most of them don't know how to treat a 19-year-old who's on the cusp of being like an adult cancer patient and a pediatric cancer patient. So research your doctors. If you're not happy with your doctor, find a new one. I've been through 4 oncologists, and I'm finally happy with the one I have now, and he takes care of me, and he's just very empathetic, and he's very sweet, and his nurses are the greatest, and they are all really good to me. And it may have taken me a year to find a good doctor, but I did. And also, doctors will tell you not to research your medicine, but research it. Research all the things that it can do to you. Because I had been given loads of medication that I never even took. They're just empty. They're just full bottles, you know, that I haven't taken. So research your doctors, research your medicine, research your case. They'll tell you not to research what you have. They'll tell you not to research the cancer, and I want to know what's going on in my body. You know, the whole reason I got cancer that was so far along was because I wasn't taking care of myself by researching what was wrong. So research what's wrong. You know, go to a doctor if you're sick. If you're not happy with the doctor, get a new one, find a new one, or at least be an advocate for yourself, because they may treat cancer, but they don't know how cancer affects you. They don't know how it makes you emotionally drained. They don't know how, you know, it makes you feel inside. They may say it causes depression, it causes anxiety, it causes all this, but they don't know what it feels like. They can only be as sympathetic, but, you know, I've learned that to them I'm just another case, so I try to take care of myself now. You know, I'll tell the doctor what I need, and if he's on board, great. If not, then, you know, I'll tell him that, you know, it's in my best interest. You know? It's my body. It's how I take care of it. If I need pain medicine, I'm gonna ask for it. If I don't feel well, I'm going to tell him I don't feel well. If I think I need a CAT scan, I'll ask for it. That's the way it is. Thank you for listening. If you have any questions, I'm completely open to anything. You know, I'm here to help. I'm here to offer understanding. Anything that you need, I'm here for. Thank you for listening, because I know this is a long story. I also will have the written version of this, which will go a little more in depth about like chemo and how it made me feel, and I also have loads of pictures and everything. So just you know, bye.